the professor here. John.
The professional?
The professional.
Mike, you and I have talked about the importance of the standing committees of the legislature yesterday, a perfect example of why it's worth paying attention to them, and that is because the acting Deputy Minister of Health, Tom Merry, was here to talk about doctor recruitment, and he said, frankly, he spoke the truth right out loud.
Yeah, healthcare is often an issue that gets politicized in Nova Scotia and other places, and the benefit of hearing from someone like Dr. Merry is there are really no politics. And what he said was that two things to keep in mind. One, we're looking at 3 to 5 years before this province can expect to have 97% family doctor coverage for people living in Nova Scotia. Two, and perhaps what I think is an even more important point to make, there is an HR issue here in Nova Scotia when it comes to doctors. Medicine is an aging demographic, as are most, and so while we are training and attracting a lot of new doctors, we're also losing them at the same time, and it means the overall net is really not that high.
No, in fact, he said it was about, over the past 10 years, about 20 doctors a year to the good for the province. It clearly is not good enough to be able to meet the kind of demand that we're looking at as you and I age. Perhaps me faster. But the other thing that's interesting about the 97% is that it proves that it was ill-advised at best for Premier Stephen McNeil back in 2013 to promise a doctor for every Nova Scotian. Mary told us that that just wasn't realistic. Much like unemployment, you were never going to get that number down to zero.
Right, and so perhaps what we've seen in recent time from this government is a tacit acknowledgement of that fact. We've seen expanded seats at Dalhousie's medical school as well as its residency program and new training opportunities. But we've also seen expanded scope of practice for other healthcare professionals, such as nurses and pharmacists and nurse practitioners, all of which is kind of a signal that on the one hand, it would be great for everybody to have a family doctor. On the other hand, it's probably not realistic, and it's also probably not really necessary, particularly for people who are of pretty good health.
If you take that 97% average that Dr. Merry talked about, you'd end up with about 20,000 people still on the waiting list for healthcare. He says the key is to find those people the kind of care they need without giving them their own family doc.
Right, and so all of that, I think, underscores one thing. When it comes to something like healthcare, we're a whole lot better off when we're focused on concrete, tangible solutions as opposed to politicizing the issue.